would you do to train other leaders, especially in a senior CEO
Hmm.
kind of
Hmm.
position, create that level of empathy, that level of
Yep.
caring, and saying, okay, I can be self-assessed and I can assess others?
Great question. And there's no simple, easy answer to that.
Oh,
But
just kidding.
uh, sorry, let me back up just a little bit. After the conversation with the woman I mentioned previously, who
Hmm.
had this moment of confession with me, there were several other conversations like that, not with that much sort of impact, but and actually in retrospect, I've had that same conversation dozens of times.
Sure, yes.
And in working with this hospital with Eileen and the other senior executives there, actually the CEO, not too long after that, the CEO asked me to come see him. And I sat down in his office and he said, I want to design a formal model. That was the word he
Mm.
used, a formal model, a way of doing leadership in this hospital.
Oh,
And I said, that's great. You need to know, though, that I think organizationally, leadership is more about the system, the
yes,
model, the way we do leadership,
yes.
as opposed to a collection of individuals exercising power.
Oh boy.
And I said, the first thing we will need to do is to identify what the system is supposed to produce, because every system produces something. And he said, that's exactly what I want to do. And without
Well, think about it.
exaggeration, I walked out the door. I said to myself, now, how in the heck am I going to do this?
Yeah, that's got to be a tough mission. But if you think about the beauty of that, if it's a system, then anybody who's trainable, who has the right attitude, can jump into that system.
Exactly. Exactly. Thank you for seeing that. I could say that a lot of times, and people go, oh, yeah, that's nice. But that's exactly the point.
Yeah,
And
they don't look at it that way. But
so you asked the question, how do you instill that empathy, that great responses when people attack you and
yes,
you're a senior leader? In this particular project, with this particular healthcare organization, in meeting with Eileen, the CEO, and Eric, the CEO, and a guy named Rick, the CFO,
hmm,
the first thing we started out with is, what do you want the system to produce? What do you want it to do? And this really gets back to your prior question. And we had lots of conversation. We put ideas up on the wall, and it was like it was going nowhere until my friend Eileen, in her usual wisdom, was really quiet. And I'd been around her enough I could read the body language. And so finally I said, Eileen, what are you thinking? And she said, we can't produce exceptional health, which is a statement out of their vision. We can't produce exceptional health until our people, our employees, feel that they are empowered to make
uh
the
huh.
extra phone call,
Okay, yeah, yeah, that's so key.
empowered to go the extra mile, to ask that extra question, to look a little deeper. And she said, we can't really produce exceptional health until our patients have a sense of empowerment, because the best healthcare is
Mhm.
when the patient is in partnership with his or her physicians, plural.
Feels like a team.
Feels like a team, precisely. And then she said, and this was a kicker for me, she said, we are a community owned hospital. We exist at the pleasure of our community, basically the county.
Yeah.
She said, our community needs to have a sense of empowerment with us. If we're going to impact the health of our community, the community needs to have a sense of empowerment as well. And this is a community of, shall we say, declining economic opportunities, has been basically a logging community. And
Mhm.
so economic activity is declining, drug and alcohol activity is increasing, all the bad stuff. And so her comment was spot on. The hospital, which is a hub of the community health,
Yes.
identified in collective empowerment. Now, at the moment, we didn't have an idea what empowerment meant. It's a big word, it's a cool word, it sounds great, but just what the heck is it?
Yep.
And but we started from that anchor. And by starting at that anchor, then we could start having these conversations and modeling. Okay, what comes after that? What kind of behaviors do leaders have to exhibit and model so that they could have a culture that was based on empowerment? And that's one of the things that was the final kick for me to start getting serious about this idea. And it was actually after that I started actually doing the research and eventually wrote a book. And so that's how all that got started.